Psychologists have read it. What's the most fascinating mental disorder you've encountered? 1. Neurologist here. One of the rarest and most intriguing conditions I've seen is Capgras delusion. The patient is convinced that someone close to them, usually a spouse or family member, has been replaced by an identical imposter. They'll say things like, "Yes, this person looks, talks, and remembers everything like my spouse, but it's not them." What's even stranger is they're often not emotionally upset by this, just very matter of fact. I've only seen it twice in over 20 years. 2. Psychologist here. I once observed a patient with alien hand syndrome. Her left hand would stroke her hair or pat her face completely on its own. She had no control over it. These episodes lasted about 20 minutes at a time. The cause turned out to be a brain tumor. Surprisingly, she didn't seem particularly bothered by it. 3. I worked with a man who heard hallucinated voices, but they weren't negative. In fact, they were incredibly positive, like a cheerleading squad in his head. They'd tell him things like, "You look amazing today," and "Everyone thinks you're so funny and charming." But this wasn't helpful. He knew the voices weren't real and felt an overwhelming pressure to live up to their praise. It actually became debilitating, just as harmful if not worse, than if the voices had been critical. 4. Hemispheric neglect is a fascinating one. People affected by it essentially forget that one side of their body exists. They'll shave or wash only half their face, brush just one side of their hair, and ignore the rest. The other side becomes totally unmaintained, like a rugged mountain man. 5. I'm a medical doctor in an inpatient psychiatric facility, and we had one psychotic patient who experienced visual hallucinations during episodes of distress. He'd see floating colored dots all around him. Interestingly, he discovered that blowing at the dots helped him clear them away. We encouraged it. It actually helped reduce his anxiety. 6. Nurse here. In our electronic medical record system, walking corpse syndrome always comes up first on the diagnosis list for some reason. It's a rare condition where someone believes they're already dead. I never understood why it's prioritized in the system, but it's real and very strange. 7. I once dated a girl who had conversion disorder, specifically related to mobility. She used a wheelchair, but both her doctor and parents said she technically could walk. Her legs just wouldn't cooperate. The symptoms started after a surgery she had as a child. They suspected she might have become conscious during the procedure. She went to physical therapy for years, and while she could sometimes move without the chair, she couldn't fully walk. It was like a partial disability, hard to understand. But I'll say this, she was absolutely stunning and the coolest person I've ever dated.